This is the FM Gold channel of All India Radio. In the program Spotlight, now we bring you a discussion on global impact of COVID-19. The participants are Kumar Bijoy, economic analyst, and Mukesh Ranjan, journalist.
Novel coronavirus, which has started in China and then spread over to US, Italy, Iran, then Dubai. Even in India, there are 2 confirmed cases which have been noticed. India made a lot of effort to bring the Indians and other nationals to India and evacuated people from Wuhan in China, and they have all been quarantined. No confirmed cases were there in India, but of late 1 in Kerala and 1 in Delhi got confirmed. 2 cases are there. 6 are being monitored there in Agra. Government is on its toes dealing with the situation and has issued many advisory, including health advisory and then travel advisories. Government has cancelled visas from few countries, from China obviously, from South Korea, Italy, Iran. So likewise, lot of steps are being taken to contain and see to it that the spread doesn't take place in India. Kumar Bijoy, the first view on this, that how far it is going to impact India vis-a-vis the world as far as the coronavirus is concerned.
First of all, I'll say that yes, this coronavirus and now the nomenclature has been COVID-19. This is a very serious threat to global economy, and India is also one of that economy. But one thing is very important, that yes, as you were mentioning that only 2 confirmed cases there. So case-wise, it has got yet not that kind of alarm, which like your Italy, Iran, South Korea has got that. Even Japan.
Even US.
Even US, yes, US. Death has also been there in US.
Deaths have been confirmed.
So, but it has got a very different aspects. One is the medical aspect, another is overall economic aspects. And what I basically feel it is going to have a long-lasting impact on economy, not only on Indian economy, even on the global economy. So if I have to talk about specific to India, you look into that, one side is that yes, tourism is a very big blow to the tourism, not only to this, even not only in India, even so many other countries, whether it is Mongolia, Chile, others, even European countries. They have started saying even it is worse than 9/11 time. It is worse than global financial crisis time. Actually, we have to look into it. When there is a crisis of economy, there is a problem related to terroristic attack. At that point of time, it is localized. It doesn't spread. But this is one which is actually spreading faster. You don't see. You don't know where enemy is. Your enemy is coming to you or not, and that panic is really very, very serious condition.
And once it reaches, it spreads like. Connected to this, just I wanted to check with you, is it not because of the interconnectivity of different nations in their economic activities? Like, I'll tell you, there are several manufacturing units in Europe and America where ancillaries and components are provided by the Chinese manufacturing units. So, this is kind of disruption in the supply chain, and this has impacted the actual manufacturing of the goods, and which in turn is affecting the economy world over.
Degree of integration always have that degree of impact, and degree of impact is going to be that high, because China, one side, when they prepared themselves as a back manufacturing center, a factory for world, certainly world is connected through them. So that impact will be there. And see, one thing we have to keep in mind whenever we are trying to make it. See, to some extent, if you consider playing with the nature, always hits very bad. And the only problem is that nature doesn't hit again and again. Nature keep on accumulating and then hit back in a bigger way. So it is something like of that nature. Only some good part with this virus is that it is not airborne. Had it been airborne, it should have been very, very serious. But still, what kind of guess estimate you can say is there that very fast it is now spreading in rest of the world. China has started containing it. Death rate has gone down, but still death is continuing. I think by tonight or by tomorrow you'll find out that approximately number will touch to something around 100,000 people throughout the globe. 88,000 has already crossed. Basically indicates that 3 aspects are there. One is, it is there. No doubt, confirmation is there. in India has to be proactive on this. Proactive in the sense that yes, of course, there are certain sources like frisking at the airport and isolating the people little coming from those areas and making sure that entire gestation period of 13-14 days should be taken care of. But still, a preventive measure is really required. And preventive measure, India, I'm little good and have a great in Indian environment because of three reasons. Still, we are having a very nice tradition. First thing is that our food habit is really very good. Second is that, that's a very important, is that we used to have that namaste by nod handshake. That's one very important aspect which our tradition actually, now we are realizing that. And third important point is that how to behave on a public place. Even normal flu. I'm not talking about this because it is initially very hard to detect what exactly which virus is actually affecting. But certainly we are careful. Like we have got lot of naturopathy and that naturopathy really is working. This is from medical point of view. You can
add to this point. Don't you think that the campaign which Prime Minister Narendra Modi had launched in his first tenure, that Swachh Bharat, because any viral disease is linked directly to hygiene, and emphasis on hygiene coming from the level of Prime Minister and the way it has been moved. Like today, the doctors are saying that you wash your hands. And exactly. Even before coronavirus, the Prime Minister was insisting upon this, that you wash your hand, and the campaign.
Understand that. See, basically nowadays, why I was talking about the traditional till date, you'll find out a good number of households in India. They don't allow to have food with your wearing shoes. When you are wearing shoes, you are not, it may be initially it has been denounced that it is orthodox, it is outdated, but now how much scientific these philosophies are there, how much it has been put into practice now in this kind of situation of alarming point, it is clear that what best practices we had already got into it. Apart from that, especially the Indian metro cities are well connected to the cosmopolitan culture. You can't stop everybody who is coming in because it is not possible and it should not be there. What you have to have is very promptly you have to be careful that, okay, kind of people who are coming, are they proper or not? And entire machinery especially had to be active to make sure that little bit doubt is there, treatment immediately, action should be taken. And along with whatever preventive measures are there. And most important aspect is people are now aware of the social media has really circulated a lot, and even sometimes you come across in the social media information that what should be the preventive measures, what should be the care we should take. So like one small care has been suggested again and again that keep on drinking water and if possible little warm water, because warm water doesn't have it. So what scientifically it was from a medical conference I was monitoring, it was there that anyone touch mouth or nose, it comes inside. But if you keep on drinking water, it will go to your stomach. From there it will get flushed out. It should not go to trachea. It should not reach to lung. That's the main concern.
This is the medical part of it, but to add to this, I must say that once you remember, AIDS was in the news. The entire world was panicky about the way it was spreading. And similarly in India, again I'll say our tradition, our family ethos, our system actually prevented, and India never became major casualty in terms of AIDS. So similarly, there is nothing to worry about this coronavirus, that COVID-19 also, in a sense that we have our own system so robust that it will take care of everything. But we need to continue with what we practice.
More concerned with that economic aspect of it. There you can't escape.
Globe is integrated and the economy is a function of the nations because a lot of interaction is taking place. So now coming back to that, two sectors are definitely going to be hit heavily, which is the travel and tourism industry. Yes. Particularly aviation. How do you see aviation going, and what do you suggest that aviation should do now?
Right now, see, basically one thing is there, as I was mentioning, that stopping the things will not help. See, an economy is an object of motion. If you stop it, it is not that kind of your very auto stylish engine that immediately it will start. The problem with this economy as an engine is, once it gets stopped, it takes time to start with. And that first thing which we have to be careful that any sector should not get affected to that extent just by simply making a kind of a blanket no to the business activity. So, but now question is that you have to save also. Kind of trade-off is really required.
Because there are like Emirates has stopped operating in certain sectors. affected areas. So that kind of measure, will it help?
Even if it is really required to that in extreme cases, it should, but it is not a solution. If it is required, you have to. See, preventive measure should be sometime don't go out, don't touch. But that don't touch will not solve if your touching is a business. Understand? That's what my concern is very different. So what is really required then in that case? You have to be little more visible on the sites, like people who are visiting. Can it be possible you can really check them? Are we equipped to that extent? If not, then in that case, it could be a blend of the two, which is a well-declared sources like China and Hong Kong and others are there. There you can think of by reducing the connect temporarily, and some other places you can by monitoring them effectively, looking into that what kind of things are there, where they move, all those various approaches. It's basically preventive plus a kind of care. Both are required simultaneously to make sure that you should not be switching off your engine.
To this context, like that depression in the global economy, do you see China going down? Is this an opportunity for India to attract investment and become a kind of a manufacturing hub?
Question is related to those issues which is affecting globe. This kind of aspects, even if it is seems positive, will not be very substantial. Reason is very clear, because India is also heavily dependent on the supply chain through China. So when your supply chain is connected to that kind of absolute advantage will not be possible.
Because you have to create an ecosystem
for that is a time consuming. Had it been like, a few months back, your talk was very on high peak related to US-China trade war. That kind of opportunity used to be there, where, you can have the Chinese relationship wherever possible, to the extent possible. This could be kind of explorations which could be done. I will give you another figure which will give you a very approximately it has been used that Chinese traveling abroad has been to the tune of $250 billion per annum, and more or less every country has said no to Chinese. Means it is a $250 billion direct impact is going to be there. I'm not talking about to China.
No,
by Chinese to the rest of the world.
Yeah.
That is one aspect. Second aspect which is very, very important is that now supply chain to the rest of the world, like auto sector, has been heavily disturbed, which has been shown. You must have seen that in last February 19th to February 28th. It is something like in the 6 trading sessions, it is approximately 12 trillion rupees has been lost in Bombay Stock Exchange. In the Indian market, you can say 11.84 trillion to be more precise, which simply indicate, you'll find out this is the financial impact we are considering. They are perceiving the kind of damages. Even OECD has come up with a very fearful figure that global GDP growth rate may come down to below 2%. Which is right now anyway revised lower side 2.9%. They are saying that it might be half if this is not a stop. If the pace of a spread is there in the rest of the world, if it is continuing. So some good news is also there that yes, various central bankers has come. Fed Reserve is there, Bank of Japan is there, other bankers are there. They all have come. They have assured that liquidity issue will not be there. We will keep pumping the liquidity. Because of that only now market has started little bit in a positive mood, because they know that government is going one side monetary authority, another side. If the government is alert, multi-pronged alertness is there. In medical side, economy side, social side, every alertness is there. These alerts certainly is going to make kind of positive and best expectation could be possible.
Be able to overcome the crisis which we have been witnessing now, and as early as possible is the hope. And since you ended on a positive note that the government, the monetary side and the social side, all three sides are working world over, every nation is working towards containing and controlling the situation. We all hope that it will not spread even beyond this, and something will be done to contain here only. Just to hope for the best. Thank you.
You were listening to a discussion on global impact of COVID-19. The participants were Kumar Bijoy, economic analyst, and Mukesh Ranjan, journalist. This program was produced and presented by the News Services Division of All India Radio. This program is also available on our website, newsonair.com. You can also follow us on the News on AIR app for updates. You may email opinion about this program at airnsttalks@gmail.com.